Because of growing online awareness, many patients believe that direct anterior approach has zero hip dislocation rate, while other approaches have much higher dislocation risk. But is it really that simple? So the question is, does surgical approach really matter? Yes, surgical approach can affect the dislocation risk, but it is not the only factor. And in my opinion, this is also not the most important factor. So when we compare direct anterior approach with other approaches, then definitely direct anterior approach is an approach where no major muscles are cut. It is also an approach where the patients regain their mobility as well as pain-free walking as well as limp-free walking much earlier than other approaches. In this approach, we do not even touch the posterior capsule or the posterior muscles, so the chance of posterior dislocation is extremely low. And the patients gain their confidence much earlier in the early recovery phase. Now, when we talk about conventional posterior approach, where the incision was longer, more muscles were being cut, the muscles were not being repaired, the capsule was not being repaired, yes, the dislocation risk was higher. But here is something really important which every patient must understand. In today's modern posterior approach, where the muscles are repaired back, where the capsule is repaired back, modern implants are being used with this approach, the chance of dislocation is very, very low. So when posterior approach is used in a modern way, utilizing the modern implants, and when the posterior structures which were cut, they are repaired, the dislocation risk is very low. The real factors which affect dislocation are these. Number one is implant position. If the cup and stem have not been put in the right place, this becomes the commonest reason of dislocation. It could be any approach. If the implants have not been placed right, the dislocation risk is higher. Number two, soft tissue balance. If the implant has been put in such a way that the leg has been lengthened too much or the leg has been shortened too much, it makes the muscles around the hip loose or tight. And in both the situations, the muscles cannot protect the hip, because when it is too tight, it comes out like an arrow. And when it is too loose, the hip is very lax and it can come out. Number three are the patient factors. If you have a nerve disease or a neurological disorder, if your muscles are poor, if you have undergone multiple surgeries, or if you had some infection in the childhood or any other problem of the hip joint in the childhood, then also you have a higher risk of dislocation, and which becomes an important patient factor. And in such situations, with good pre-operative planning, we choose special implants for these cases. And number four is surgical experience. See, when you go to a surgeon, ask your surgeon which approach he has been doing the most, with which approach he has most experience, with which approach he has been getting good results for his patients. And number five, and this is the most common misconception patients have, and I want to clarify it. No approach to hip replacement has zero dislocation rate. No approach. If all these points which I just mentioned are not taken care, then hip dislocation can happen in any approach. I hope in this video you got clarity on different factors which affect the dislocation and how important is the surgical approach to prevent that. Thank you so much for watching.